Let's discuss inquiring chills and fever. The production of chills and fever is related principally to the abundance or depletion of the organs yin-yang. Illnesses resulting from the exposure to cold, evil generally manifest coldness symptoms, whereas those resulting from exposure to heat, evil generally manifest hotness symptoms. Yin abundance or yang deficiency mostly shows coldness symptoms, whereas yang abundance of yin deficiency mostly show hotness symptoms. Hence, asking about chills and fevers helps to understand the nature of pathogenic evil and to ascertain the ampleness of the body's yin and yang. Clinically, chills and fever can manifest the following patterns. First, the cold aversion and cold intolerance. Cold aversion means that the patient dislikes cold and feels better when warm. This occurs mainly in various conditions of internal injury. Because yang qi is deficient, it is unable to warm the exterior. Cold intolerance means the patient dislikes cold and does not feel better even when warm. This occurs mainly in exogenous illnesses of the exterior. Because evil qi has attacked the exterior and defensive yang is obstructed, the exterior loses its warmth. Simultaneous fever and cold intolerance occurs mainly in exogenous illnesses, especially in the early stages. If there is more intolerance of cold than fever and the pulse is floating and tight, it is a cold illness in the exterior. If there is more fever than intolerance of cold and the pulse is floating and rapid, it is a heat illness of the exterior. If the cold intolerance and fever are accompanied by sweating and a floating and even pulse, it is a deficiency illness of the exterior. If the cold intolerance and fever are accompanied by aches in the body and head, but not sweating, and the pulse is floating and tight, it is a strength illness of the exterior. Next is fever and feverishness. Fever means a body temperature higher than normal. Feverishness means feeling hot despite a normal body temperature. Fever and cold intolerance occurring in same illness are mostly due to exogenous pathogenic evil in the exterior. Fever without cold intolerance is mostly due to interior heat. The most common pattern are the following. High fever. The body temperature is greater than 39 degrees Celsius, is persistent, and is not accompanied by cold aversion. This occurs in illness of heat strength and results mostly from exogenous heat or exogenous cold entering the interior and transforming into heat. In the latter case, strong heat in the interior has diffused to the exterior. Next, recurrent fever. In this condition, the fever or feverishness occurs regularly like the tide. Hence, this is also known as tidal fever. There are three such patterns clinically. Recurrent young fever. The fever is typically quite high, especially between 3 and 5 o'clock in the afternoon. Also typically abdominal distension and constipation accompanied by fever. It is the result of heat evil mixing with the chyme and retained food in the stomach and intestines. Recurrent fever of dampness heat. In this pattern, the skin does not feel hot when first touched but becomes hotter with prolonged palpation. The fever tends to be mild in the morning or night but rises in the afternoon. It is accompanied by chest tightness, heaviness in the head and body, and a greasy tongue coating. It is the result of dampness and heat accumulating in the interior and the trapped yang qi not being able to reach the exterior. Recurrent fever of yin deficiency. This is typically a low-grade fever in the afternoon and at night. Along with fever, there is a flushing of the cheeks, night sweats, and hotness in the five centers. This is due to internal heat arising out of the yin deficiency. During the afternoon and at night, defensive yang returns to the interior, causing the interior temperature to rise. Next is low-grade fever. Here, the temperature is typically between 37 degrees Celsius and 38 degrees Celsius. It is often seen in illness due to deficiency of yin, blood, or qi, as well as in the late stages of heat diseases. Dysphoria with feverish sensation in the chest, palms, and soles. This is a feverishness in the chest, two palms, and two soles with dysphoria. The body temperature may or may not be raised. It is mainly seen in illness of interior heat due to yin deficiency, but also when exogenous heat evil has entered the yin level of the warm diseases, nutritive or blood level. Next is alternating chills and fever. Alternating chills and fever reflect the struggle between evil qi and genuine qi and is due to evil qi accumulating in the area between the exterior and the interior. Clinically, it has two main patterns. In one, the alternation is regular. This is a typical of malaria. In the other, the alternation is unpredictable. This is seen mainly in the illness of Xiaoyang meridian. Thank you for your attention.